turning to our program, please welcome Jackie Frederick, retired CEO, Versity and Blood Center of Wisconsin, to introduce our speaker.
Good afternoon, and thank you. What is more precious than the children we hold so dear in our homes, our communities, and indeed in the world? Who in this room doesn't know a sick child touched and cared for by our own Children's Wisconsin, whether our own child, a friend, a colleague, a neighbor? Many saved by first-of-their-kind treatments developed here and now saving lives throughout the country. Children's Wisconsin has more than 7 million connections with kids and families throughout our state each year. Today, Gil will discuss the capabilities to support children now and into the future. Gil Peri became president and CEO of Children's Wisconsin in August 2024. He leads a team of nearly 8,000 team members who support our kids and families through world-class medical care, impactful advocacy, transformative research, and purpose-driven education. Gil's career has been defined by a passion for being team-first leader that creates one-team culture, strong performance excellence operating systems, and operating strategic growth and partnership platforms to improve child health and well-being. Under his leadership, Children's Wisconsin is advancing the services across the continuum of care, from primary, specialty, and hospital care to mental and behavioral health to community-based services. Gil has had the opportunity to serve on executive teams of several top children's health systems and has degrees from the University of South Florida. Gil advocates for kids and families through his engagement in our community organizations. He currently serves on the boards of the National Children's Hospital Solutions for Patient Safety, Wisconsin Hospital Association, MMAC, the United Way of Greater Milwaukee and Waukesha, and the Medical College of Wisconsin. And if that's not enough, he also supports the development of future healthcare leaders as an adjunct assistant professor in the Institute for Health and Humanity at the Medical College of Wisconsin. Please welcome Gil Peri.
Thank you, Jackie and Mary and Kent, for having me. I was really excited to join you. This is an esteemed group. I've learned a lot about this group, and so honored to be here and represent Children's Wisconsin. We are going to do a few things. I thought I would be helpful to level set a little bit about who Children's Wisconsin is. And so I'll walk you through a little bit about our history, who we are. I'll share with you a little bit about what we're up to right now, and then give you a peek behind the curtains about where we're headed as an organization, and of course have plenty of time for questions. I should shout out to our team who put a box here. Because of my height, I am very well supported. Thank you for that. I don't know how many of your guests need a box on the microphone. Am I the first? Okay, good. I'll take that. So as Jackie mentioned, we have the privilege and honor and accountability to serve over 7 million kids a year in the state of Wisconsin. These kids don't all come to one of our bricks and mortar locations. Importantly, we serve them preventively and through the community. And so one of my goals today is to share with you, of course, we have a hospital. It's the best children's health system in the country from my perspective, the only one in the state of Wisconsin. And we will take care of the most significant concerns that any child in the state needs. And we're so much more than that. You can see that we have 351 beds in the Milwaukee and Fox Valley campuses. We also have partnerships throughout the state that allow us to care for kids who don't necessarily have to come all the way to Milwaukee or the Fox Valley. We have partnerships with Bellin and Theta Care and Marshfield Clinic and UW Health, because our expertise is very hard to replicate, and so they oftentimes will rely on us to provide that level of support and expertise throughout the state. We have lots of different external validation of the work that we do here. I won't go into the detail, but recognized as one of the top children's health systems in the country. Magnet, which is a nursing designation. We were fortunate enough to receive our 5th designation, and less than 1% of health systems across the country can say they've received that. And so we are very, very honored to provide this level of support. We're about a $2 billion organization, unfortunate to be supported by our community at about $40 million a year, and we reinvest our margin into our community. So any money that we make, we are really good stewards of reinvesting in people, in technology, in systems, in programming, and lots of community benefit services. We will serve every kid regardless of their ability to pay. And so our focus is making sure kids have what they need, when they need it, and in the locations that they are most apt to receive that care. We also are very, very fortunate to have a affiliation with Medical College of Wisconsin as our academic partner. As a children's health system, we are never, ever satisfied. If we are just focusing on clinical care, that would not be our mission. Because of our partnership with Medical College of Wisconsin, we also train the next generation through education and training. So all the pediatric residents come through our facilities and are engaged with our expertise, as well as research and discovery. And so I see many of my colleagues across who are also on the MCW board, who really invest in making sure that we have the best and brightest, not only for today, but for the future. And that's one thing that keeps me up at night, is making sure that we have the talent to be able to continue to meet the demand that our kids have. And so we are very comprehensive, and Jackie said earlier, but I would like a show of hands, who has either been individually connected to children's or impacted by children's, or a family member or a friend? Just raise your hand. Okay, about 93.5%. Hi, Anthony. So that's about what we see when we go throughout the community, to understand that we have impacts in lots of different ways. And so here is a little bit about our statewide impact. Many people think of us as Milwaukee, and of course that's where one of our hospitals is located. But if people ask me, what is the real impact of Children's Wisconsin? It's not just our hospital. It's every connection that we make in the community. And I'm very honored to have 2 of our leaders with us, Karen Timberlake and Bridget Clemente, who represent a lot of what happens not in the hospitals, but in the community. They oversee child well-being, community health, our government relations and external affairs, because what we do can't be done just in the hospital. Our focus is to try and prevent and intervene early so that hopefully they don't have to come to the hospital. And so very, very important. And you'll see this map that we have lots of different services throughout. We have 49 care locations throughout the state where we try and provide care close to home. Oftentimes transportation is a barrier for folks. But just as importantly, we have community health, school health, different proactive interventions sprinkled throughout the community. And some people may say, well, what about the northern part of Wisconsin? What's up with that? Why don't you have any dots there? 2 things. One is we do have some affiliations that pull from the north, but 2 is the density of kids in those markets are very, very thin. And so we have to be really good stewards of our dollars, and we put our bricks and mortar in places where we think we can best serve kids. And we connect with them virtually. We have a whole virtual health platform that allows us to connect across the continuum, oftentimes reducing public health barriers of transportation and ability to access services. We also have a health plan as part of our organization. It was referenced earlier. We have a Chorus Community Health Plan that allows us to take care of Medicaid patients and, again, proactively care for them, not reactively. So the state of Wisconsin has 1.25 million kids. All those kids are our responsibility. We take it personal. We know that those kids need things, hopefully before they ever need quote unquote traditional health care, between visits, and then afterwards. And so those 1.25 million kids are our responsibility. Thankfully, 93% of kids only need primary and secondary care, which means the lowest levels of care. About 7% of kids need what we call quaternary or tertiary quaternary care, which is the highest level. So think about traumas or heart patients or cancer diagnosis that need the higher level of care. And so this is why, to the right, you see a little picture of a human, that a majority of what kids need are based on their socioeconomic status, their environment that they live in, the genetics, and the importance of how we support them beyond what we do for them in the healthcare sphere. And so that's why we focus so heavily on not just the healthcare, but the well-being portion of our mission. And so we have a really strong system of care that you see here. Of course, the hospital you see to the right, community health and education is an example. We have child health advocates and navigators that proactively go into homes and support patients and families where they're at, reducing barriers wherever possible, and really trying to customize care and solutions for patients who maybe have barriers and can't necessarily access them in traditional mechanisms. We have the social services organization that we run for the state for foster care and adoption. Most people don't know that Children's Wisconsin is the entity that supports that population. And then our close to home facilities, which many of you drive by, you see the big logos, the Blue Kids, which by the way, anytime I'm wearing a Blue Kids pin, it takes me an hour to get about a gallon of milk. You guys know that? The brand that's been established here, 130 years, is such a strong brand. And so we want to make sure we bring that brand out into the community to make sure it's easier for them to access the expertise at Children's. And then I mentioned the health plan and our ability to really use data to inform how we care for kids. I'll pause here to share a little bit more about where we are today and how we're thinking about our current operation. And so from a market share perspective, if you think about the number of kids that we serve, a majority of the kids that need high-level care come to Children's Wisconsin. Many of the kids who need the primary and secondary care come to Children's, but not always. And so that's why those partnerships are really important, that we partner to make sure our expertise, our protocols, our ability to make sure that kids' care is at the level that every child deserves is really important. Increasingly, Children's has been notorious for creating very formal partnerships and knowing that we can't do this work by ourselves. We are oftentimes the catalyst and working on some very, very big topics. And so I'd like to recognize Dr. Eve Hall from the Greater Milwaukee Urban League, who is not only on our board, but has been a phenomenal partner in our gun violence prevention work with Karen and with Bridget and Jen Mance and our team. We have unfortunate challenges throughout the state of Wisconsin, but specifically in Milwaukee related to gun violence. And it's now crossed over as the #1 killer of kids. So as a children's health system, we can't admire the data. We can't say, well, we're trying our best. We want to do something as a community. And so convening the best and brightest minds in this city of Milwaukee, there's been a couple meetings already and one coming up in April 17th, because we want to make sure we bring the right interventions and support to this community, because we can't allow bullets to kill kids and communities. And by the way, when you come to the health system and you see a gunshot wound come in, of course, you care for the patient and the family who's in the trauma bay. But when you go into our lobby, who do you see? You see the pastor, the cheerleader, the best friend, the bus driver who picks up this kid usually on the way to school. That's who you see impacted by gun violence. And so gun violence doesn't only harm families and kids, it harms communities. And so this is why it's a big priority for us to really focus on. Also, mental behavioral health, as was mentioned earlier, is a big, big focus for us. Thankfully, way before I got here, the organization doubled down and said, we are going to lead the country in providing support for mental behavioral health. One of the things that's important to know is that this is not just as a result of the COVID pandemic. It's always been there. It has exacerbated over time. And Children's, during this assessment, said, we're going to do something that's unique and different. So what we did is we decided to embed mental health professionals in every one of our primary care settings. We have 102 primary care physicians. Every one of our buildings that have primary care have a mental health professional inside the building. It's called integrated mental behavioral health. And so when you walk in, you go left for traditional medical care, and you go to the right for mental behavioral health care. Unfortunately, and this is not just in Wisconsin, but throughout the country, mental behavioral health is becoming a big focus for a lot of care providers. The one statistic I like to share is if you line up 10 high school students, 10 of them, 7 have contemplated suicide in the last 6 months. 7 out of 10 high school students have contemplated, not necessarily attempted, but contemplated suicide in the last 6 months. And so while we care for kids and all of kids, we know that if we don't care for the mental and behavioral health needs of kids, we are not caring for kids. And so really proud of the work that the team has done. Not only do we embed within primary care, we also have mental health walk-in clinics dedicated to kids who have mental health challenges. So instead of going to the emergency department and waiting with a lot of medical challenges that go in there, they go to one of our 3 mental health walk-in clinics. We have one on the Milwaukee campus, one in Kenosha, and one in Green Bay. And we have kids, I saw a 5-year-old who went to the mental health walk-in clinic because that's the level of support that they needed to either stabilize or get triaged to the right level of care. And so it's an amazing service, and we're grateful for our community partners. Many of these services that I'm referencing do not get reimbursed by our traditional payers or our state payers. It requires the community to say, I want to do something about it, and I'm looking around, Joanne and others have really stepped and said, how can we support children's? And so we are grateful for the support that we have, that we can do better for kids proactively, not reactively. And so I want to share a little bit about what makes children special. Again, I've been here just over 18 months, and I've been in different children's health systems as I've grown in my career. The one thing I've noticed that is at least 30% better than any children's health system is our team. And I tell anybody who visits, we have amazing buildings, whether it's a Milwaukee campus, Fox Valley, out in the community, we have amazing buildings, we have amazing technology, we have all the tools that physicians and APPs and others need, and none of it matters. It's our team. As a matter of fact, we have a ceremony that we typically do, and you're not going to be able to see this, but I'll hold it up here, but I'll describe it. This is a picture of Mary. Mary is getting ready to ring a bell. Does anybody know what that means? Okay. So she has defeated cancer. She is in remission from cancer. And so this is a picture of Mary staring down the bell before she rings it. And I have this in my office as a reminder of why we do what we do. And so when you look at who was at her bell ringing ceremony, of course it was her physicians, her nurses, her APPs, et cetera. It was also the unit secretary, the valet, the facilities team, the environmental services team, those who really support all the care that we provide. And so we have a concept at Children's called One Team, and I brought my shirt so you guys can see it. Jackie and I were talking about this. One team is why we are different. Every single one of the almost 8,000 now team members who care for kids, no matter if you're in the community helping people with food insecurity, a psychologist who's helping through a very challenging situation, a valet who's giving a warm smile or making a patient or family laugh, every one of us, no matter our skill set, are allowing Mary to ring that bell. And so our number one asset's our team. We focus a lot about how we can support them, put them in the best situation, put the systems in place for us to really make a difference. As a matter of fact, one of the things that Mary put on her card that day is, after 800 days, peace out, chemo. That's Mary. So that's a very children's thing to say. And so I bring that up because what this organization means to the state is really important. We have almost 8,000 team members who wake up every single day dedicating their lives to kids. They did not want to go into adult health care. They didn't want to go be a banker. They wanted to make the lives of kids better. And we are honored to support them in their venture. Oftentimes, we have challenges in recruiting, and so we focus a lot on how we keep and retain the best and brightest and then attract the best. The other thing I'm really excited about is the future is we have a very robust strategic plan that we're in development. At the end of this year, we will be sharing publicly what our strategic plan is. We have technology on our side, we have research and science on our side, we have community interventions that we're going to be able to hopefully take to the next level together as a community. We also happen to be on the Milwaukee Regional Medical Center campus, which for those of you who have been to that campus, see that we have something that many academic medical centers don't have, and that's land. So I'm partnering with the Freighter Theta Care CEO and Imran Andrabi, Chris Miskell from Versity, and I are hosting a very, very robust visioning campus development project. The campus will look totally different in the next 10 or 20 years than you see today. We're building it for 50 years from now. We're wanting to make sure we have the assets on campus that attract and retain the best and brightest, and most importantly, meet the needs of all our community, from kids all the way through adults. And so I'm really excited about that work. It kicked off. We have full alignment, and we're going to be really aggressive. We think that Milwaukee has a lot to offer. And one of my observations when I got here, people always ask me, what do you think about Milwaukee? I am so bullish on this place. I love it. My family and I have been embraced. There's so much to do. Cuisine, arts, sports, everything you can imagine for our families, schools, public and private. We have everything in this community. And so I want more people to be able to enjoy what we have here. We should be in the same sentence as Charlotte, Portland, Austin, Denver, all those cities that have the limelight, if you will, right now. Milwaukee's as good, if not better. And so part of my role and my team's role is to make sure that we continue to make this city as bright as we can and attract more and more people to this community. And so with that, I invite you to continue to engage with us however possible. Hopefully you never need any of our tertiary or quaternary care. Our hope is that we never see you in that vein. But remember that that's not all we do. It's an important part of what we do, but just as important is our prevention work, our early detection work, and making sure we have the healthiest kids in the country. So with that, I would love to open it up to questions and be able to answer those for you.
Thank you so much for those comments, Gil, and I am here.
Hey, Gail, thanks so much for speaking. I'm Carol. It was nice to meet you. I was just wondering when children started integrating the mental and behavioral health support.
It was after COVID, and then formally we were fortunate to receive philanthropy by the Yabuki Foundation. Jeff and Gail Yabuki were very generous to enable us to go really deep into that. And so in the last 3 years especially, we've been able to integrate into all of our facilities. And then, like I mentioned, the walk-in clinics have been phenomenal because our patients can go there instead of going to the ED for a mental behavioral health exacerbation. The other thing I didn't mention, which I should, with those resources that we receive from the community and the generous donors, we also do research. And so we were able to hire a phenomenal researcher to really make sure what we're doing is evidence-based and has a return on impact, if you will. So many of you are return on investment folks in your world. We have a return on impact, and so making sure that every dollar we spend really makes a difference in the kids' lives. And so research is a really big part of what we do with our MBH.
Hi, Margaret Keene. I once volunteered at Children's. I want to get back to doing it.
That's why I'm here. I have an agreement right here for you.
Question for you. I'm a retired GE healthcare in electrocardiography, and there was a fairly large program going on when I retired across the country on screening and sudden death in kids. Is children hooked into any of that?
I will defer. Yes, I don't have the details, but it looks like our team says yes.
Good, because I can rehook you, and it's being headquartered at Duke, and they're looking for lots of folks to get involved in this. So.
Yeah, so I think Bridget Clemente would be the best person on our team to be able to engage. Maybe afterwards you can connect with her. What I'll say is if there is an evidence-based prevention expectation, we're usually involved. It doesn't mean that we own it or that we're driving it, but we are typically involved in a lot of things that are going to help improve child health. Thank you.
Hi, Dan Jenkins, retired recently from MCW and Freighter. So can you talk about healthcare disparity? I mean, we talk about it on the adult side, but in the city of Milwaukee with food insecurity, illiteracy, so many problems, housing, et cetera, comment how Children's is looking at healthcare disparity in various zip codes?
Yeah. As he mentions, we unfortunately in healthcare, and this is not uncommon across the country, the zip code or block code that you live in can be a big predictor as to how your healthcare is going to go. Based on where you live, oftentimes is a correlation, not always, of how your healthcare is. We're not satisfied with that. And so what we do is we try and provide care close to home where we know that there's those barriers. We work with community partners to address what is the barrier to healthcare, what are driving those disparities, and we do the best we can. I can't say we always get this right, but we do the best we can to not just study the data and understand the disparities, but to target interventions accordingly. And so depending on the disparities, our teams work and support existing organizations that are doing the work and potentially even do work from scratch. And so it's a big issue across the country. Milwaukee, unfortunately, has indices that are in the bottom decile and sometimes quartile in child health outcomes. And so we are focused on how do we create a network of lots of different organizations, community agencies who can join us in really doing something different to move the needle. So we are not a bottom decile or, state or city. We want to be in the middle or leading the pack. And so we have a lot of different focus on where we want to make a big difference. The other thing I'll say is we have researchers on our team that do health science research to really understand those disparities and really give us the root cause of what they are. We want to learn from them and integrate their work into our interventions.
Hi, Gil Velez. A little bird told me that you thrive on engagement with your team members and voice of customer. I'm wondering if you can tell us about traditional or non-traditional ways you find to connect with those groups while maintaining your day-to-day CEO responsibilities.
Yeah, Jackie mentioned, and I shared with you guys, the number one asset we have at Children's is our team, not our buildings, technology. We have 2 million square feet on campus, another million out in the community. None of that matters, because who's actually opening that door every day to try and make a child's life better? It's our team. And so I'm very purposeful, and I screen for this when I hire leaders and have an expectation that we're visible and available. So just a couple examples. I do a CEO swap once a month. Maybe some of you may have heard about this. Literally, I haven't missed one in 15 months. Where I literally go and do their job for a half a day, and they are in my office doing my job for half a day. You do have to be employed for me to swap with you, at least at this point. And why do I do that? Because I can only learn from really walking in someone else's shoes. And you know, I do rounding and those type of things, but sometimes when you're only with somebody for 5 or 10 minutes, you can't really get an understanding and a respect for the work that they do, and vice versa. They have an understanding of what I do as the CEO. And then once a month, we get on with all of our leaders on a virtual meeting, and we share our stories. I share what I learned. I share something that was new or different for me, and they do the same, and it's kind of a nice shared learning. So I think those type of things, wherever you can be in someone else's shoes to show a sign of respect and understanding and curiosity, is really important. I also have a tradition that I have a chocolate Friday rounding. So who doesn't like chocolate on Fridays especially? And so I pick one clinical and one non-clinical unit every Friday. Haven't missed one. Just again, an opportunity for me to be out there engaging with people proactively. And then we have our formal rounding systems where we have our operators who round consistently every month, et cetera. And I join those wherever possible. But I have an expectation of myself, and my office supports me in making sure a large percentage of my time is enabling us to really understand what our team members need, at the same time guiding the organization to the future. But without our team, we don't have an organization.
Hi, Tom Gale. Thank you for being here today. Having served on the board of Sojourner Family Peace Center for 9 years, I'm keenly aware of Children's Hospital and Peggy Troy's involvement. Without you folks, that facility would not exist. You also maintain a clinic in there that serves an underserved population. Thank you for that. Are you aware of your services there?
Yes, very much. And what he's speaking about is our child advocacy centers as well that allow us to care for the abused and neglected. And oftentimes there's others that provide that service, but we have 7, I believe, 7 child advocacy centers throughout the state, not just in Milwaukee or in the Fox Valley. I'll tell you a quick story. I was visiting one of them, and one of the nurses said, "Come into this room." And she had, you know what fatheads are? They're like little posters you put on the wall, and they were all about the Bucks. So there was Giannis and the Bucks. And she says, "I went across the street and I, with my own money, purchased shirts for boys, teenagers, because we have plenty of stuff to give younger girls who come in, et cetera, but the boys didn't have anything." So she went on her own dime and bought half off sale on these t-shirts. Sometimes these kids come in with only the shirt on their back. They may not have a home to go back to after we support them and stabilize them. And so the child advocacy centers allow us to really care for those who need us most. And so that's a perfect example in Sojourner, and the partnership there has been phenomenal.
Jeff Spoler. Sometimes it's said that there's not a high level of cooperation between Madison and Milwaukee on various things. Could you describe your level of cooperation with the Children's Hospital in Madison?
Yes. So we are the largest independent children's health system in the state. So that means that we only focus on kids. Nothing against adults, but kids are our future. That's who we focus on. And so that's all we do. I report right to the chair of my board. We're not part of an adult system, and that's very purposeful. It allows us to partner with lots of different organizations and always do what's right by kids, not have to worry about negotiating with what the adult healthcare needs are versus kids. So UW has a health system, unit within their health system that is a children's hospital. They do a really nice job in Madison. Majority of their patients are in the Madison community. We have a partnership with them that we've established in heart. There's not that many heart cases in the state of Wisconsin. And so what we said is let's bring our best experts together and do better for all the kids. So we have a joint venture that allows us to say, no matter what, you're gonna get the benefit of all the expertise in at Children's Wisconsin, as well as UW Kids. We're about 2/3 of the market as it relates to that program, but we want to make their program better, and they're going to make ours better. And so that's an example. I'm meeting with Alan Kaplan, the CEO of UW Health, on Thursday for breakfast as an example. So we have lots of good conversations, and I think you'll see more coming from these partnerships.
Hi, Gil. My name is Dan Nelson. My question is, how are you measuring the return on impact, a term I haven't heard before, of your behavioral and mental health programs and services?
It's a really important question. Obviously, the first metric is how many kids are we serving? And obviously, there's a pipeline, and you can imagine that pipeline is very large. And so, again, I give credit to Karen and her team about really being innovative of how we provide services. And so volume is one thing. But then the outcomes of how we serve them is another. And that's why that researcher, Dr. Gaffrey, is so critical to really understand, are they getting better? So it's one thing to provide services, but are they actually improving? Are they meeting their care plan goals, et cetera? And then the third, from an impact perspective, is how are we helping others be better in this space? And so I know there's folks from Rogers and others. This is a continuum. No one can do it all by themselves. And so a return on impact is how do you create a continuum of care that allows a kid, no matter what they need, to be able to plug in and get high quality care. And so those are the ways that we address that. Thank you for the question.
Hi, Gil. Thanks again for being here today. We keep hearing more and more about the impact of private equity in healthcare. And what are you seeing in particular in your healthcare system and then in competition? I saw there were 2 clinics opening up in Milwaukee and this month, I think, that are funded by private equity. And so things are changing out there.
Yeah, I'll start off with the broader macro environment. Private equity, typically in our industry, goes in areas where we are either not paying attention or we don't have time to focus on that. And so what they'll do is they'll see identified problems and they'll say, we can go solve those problems. In this case, they've identified commercial markets, not Medicaid markets, but commercial markets that have maybe an untapped need, and this is specifically in urgent care is what you're referencing. And so because we're not necessarily there, they think they can go ahead and meet that need. And they typically will. What we've seen across the country is they have a very narrow focus. They do it really well, really high tech, high touch, and then they expect partners to do the rest. And so they'll do a very defined need. And so the way we handle that in our industry, and specifically what we're doing at Children's Wisconsin, is those that are coming into our market, we embrace with collaboration and partnership. Those kids will be stabilized or maybe get what they need immediately there. They oftentimes are not staffed like we will, so we want to provide them education, information, whatever that might be. Again, because our focus is healthy kids, regardless of where they go. And then as they have triage and referral needs, we want to be their partner to be able to care for whatever they don't do. And so that's really important. Increasingly, where we see private equity coming in is through the digital space and technology and AI. Many of your industries are facing the same thing. We're being very thoughtful about how we engage AI to make it better for kids. And so making it easier for our teams to care for kids, as well as leveraging digital technologies to change the way we care for kids today. And so you will see, and it'll be a big part of our strategic plan, that we're going to be adopting a lot more technology to expand our care model.
Thank you for being here today. I'm Ryan Daniels. I wanted to actually build on your roadmap and what you just said relative to AI. We're hearing a lot about how this is going to impact us overall, but I'd like to understand your view as providing healthcare to children. Are the same kinds of studies being done with the scans, et cetera? And what would you see as the impact of AI as we look at the roadmap to the future?
There's a couple ways that we're thinking about AI and how it's going to make us better for kids. One is enabling our team members, what we call our employees team members, enabling them to work top of scope. And so if I can eliminate 20% of their daily workload that is maybe bottom of scope, not important, waste of time in their reviews, they will tell us that, then that means they spend more time with kids, or more time at home, or going to a soccer game that fills their bucket with joy and comes back refreshed the next day. So that's a very important part of what we're thinking about. How do we make it easier for our team members to do their work and engage with families at their top of scope? The second is in the clinical space. As you mentioned, radiology is an early out on AI. How do we use technology to make our clinical decision-making easier, faster, or better? And you see healthcare lagging a lot in AI because of all the regulatory and risk that we have. If we don't do it right, it's not like it's a widget. We're talking about somebody's life. And so we are very careful about it. That being said, is we are making sure we are embracing it and understanding where there's evidence that it works, we're going to be adopting it. And then the third level is in the community. We know that everyone's going to be digital natives. The population that we serve, both parents and kids, are digital natives. If we're not digital, we're invisible in our industry. And so we got to make sure when we engage with our patients and families, we have the right digital tools, the right predictive algorithms from an AI perspective to allow us to speak their language. If we don't adopt, they won't be served, we won't be able to serve them.
Hi, I'm Kate Bartlett with HGA, and one of the trends that I'm seeing with neurodivergent children and also mental health is that there's a disconnect between what information they can get in the school and what they can get at the medical system. And so I was curious if there's going to be an opportunity for healthcare professionals to get into the schools to bring that healthcare and those resources to those students directly.
One of the programs that Bridget leads is a school health program where we embed nursing and other professionals in the schools, not all the schools, but in many of the schools, to be able to provide that level of consultation and expertise as well as service. Increasingly, our neurodevelopmental program is thinking about how they can engage community as well, because they know that when they get to the clinic, it's probably too late. We need to make sure that we go upstream. And so working with our partners, again, a big theme I want you guys to take away from today is we don't do this alone. Our partners enable us to do this. We're able to share in the care of those kids. Very important population for us to serve.